out there that you can read more about. For this next part of the program, Diane Schrauth, Schrauth Consulting, is going to be our moderator, and you want to hear actually from our two distinguished guests who she will be introducing. So I'm going to turn it over now to Diane.
Folks hear me? All right, great. Thanks to Delaware Valley Grantmakers and the College of Physicians for the opportunity to be here today with you. As Walter said, my name is Diane Schrauth, and I'm a consultant to foundations and other organizations on water and environmental issues. Some of you may know me because a little closer. Okay. All right. Some of you may know me. I was a program officer at the William Penn Foundation for many years, where I led the foundation's efforts to protect the region's water resources and also worked on the foundation's strategy related to natural gas drilling in Pennsylvania, which is how I got to know the folks at Delaware Valley Grantmakers and some of the other funder colleagues working on this issue. We've done a series of programs, or Delaware Valley Grantmakers has actually done a series of programs for funders on the Marcellus Shale issue, and this is the latest in that series. So thank everyone for being here today. This panel is going to focus on the potential human health effects of hydraulic fracturing. A lot of those issues were already kind of covered in some part by the first presenter, so I'm not going to go into a lot of detail. I will just say that in case this is a very timely topic, especially since New York State announced their decision to review the potential public health effects on natural gas drilling before they release their regulations on the process. So if folks haven't seen it, that is in today's New York Times, and I think it's very timely for this discussion. Our speakers today are Raina Rippel and Carey over here, and they're going to talk with us about work that they're doing to understand the potential human health effects. Raina is the director of the Southwest Pennsylvania Environmental Health Project, which is a mouthful. It's a nonprofit health organization created to assist and support residents in Washington County, Pennsylvania, who believe their health has been impacted by natural gas development. And Dr. Carey is an Associate Chief Research Officer and Director of the Weis Center for Research at the Geisinger Health Systems. And David, I guess since you're standing, I'll let you go ahead and go first if you want. Is that okay? So let me just say a minute first about how we're going to work the panel. Both of our presenters are going to speak for a few minutes on the work that they're doing. And then the three of us are going to have a conversation up here for a few minutes. And then at the very end, we will open it up for questions from the audience. What I would ask is, on your seats, there should have been some note cards and little pencils. And we're going to ask folks during the question and answer to write your questions on cards, and we'll ask you to pass them up at the appropriate time. So with that, I will turn it over to Dave.
Okay. Can you hear me? All right. So I want to thank Walter and the other organizers for the invitation to come to this very exciting meeting. There's a lot of energy in the room, and also to come to this historic and beautiful building. So it's a great venue for this type of meeting. So I appreciate that. So as Diane said, I'm from Geisinger Health System, and I'm going to tell you about things we're doing in what we're sort of generically referring to as the Marcellus Shale study. So this pink blob up here is the reason we're all here. It's the Marcellus Shale formation. It's reported to be the second largest reserve of shale gas in the world. So for obvious reasons, it's generated lots of attention in terms of economic development. It's now an important part of our national energy strategy. Been a lot of activity within the Commonwealth of Pennsylvania, so the Marcellus Shale formation sort of arcs across the state this way. This is data we put together where we've geocoded. This is data through the end of last calendar year. Well permits, so the red dots. You see that there are nearly 10,000 well permits as of that time issued in the state. And then these green blobs are where there's actual gas production. So you can see there are really two major focal areas of production, one down here in southwestern Pennsylvania and one up here in the north-central, northeastern part, which is really where our interest stems from. So I work for Geisinger Health System. We're a private nonprofit integrated healthcare system, and this gray area is our patient catchment area. So you see this is literally going on within our backyard. So as a health system, we have a vested interest in the health of our patients, so that's really what's driving and is the motivating factor for us doing this. So why is there concern? I don't think we need to spend a lot of time on this. We've already touched on this. Chemicals with known toxicity are used, sometimes in large quantities. There are plausible pathways of exposure. The communities are affected. But really, the true impact is still unknown. There have been studies. Most of them have been small, either biased, not scientifically rigorous, not coordinated. And the study you heard about this morning is one of the few really attempts to do this in a rigorous fashion that looks at all the scientific evidence that's available. But in the end, I think there's a real paucity of reliable data, and I think we would all agree on that. The other reason this is of interest, this is poverty rates by county, the data that our analysts put together. Again, if you remember where that big area of drilling is in north central Pennsylvania, it's squarely within an area that has higher than average rates of poverty. So these are vulnerable communities. I'll tell you a little bit about Geisinger. We are an integrated system. There are three main parts. Geisinger Clinic is our multi-specialty physician group practice. It's now 1,000 physicians. We own and operate 5 hospitals in the regions and a network of about 40 community-based outpatient clinics. And we also have an insurance company, Geisinger Health Plan. We don't insure all of our patients, but many of them, so 300,000 members. A very high emphasis on quality and prevention. So that's one of the reasons that I think this is of interest to us as well. All of these, and I say integrated, it means all of these entities report up to a single CEO and board of directors. So there's a lot of cooperation and integration among these different functions, which is unusual for a US-based healthcare system. Again, this is just a map of our catchment area showing some of our patient service areas. One of the other reasons that we think we can make a major contribution to this discussion is that Geisinger was one of the first adopters of electronic health record systems in the US. So we made a strategic commitment to do that in the 1990s. We used a system called Epic Care, which is one of the most widely used systems in the country. We spent a lot of money keeping it going, but the real point here is that we have lots of patient data on hundreds of thousands of people that live in this area. It's all electronic now, so it's searchable and mineable, and we're already developing ways to use that data to do population-level health research. Now, the decision was made last fall to leverage those resources to study the health impacts of Marcellus Shale mining. So at that point, we realized that this was a big problem, bigger than we, Geisinger, could tackle on our own. So we set out to create essentially a coalition of stakeholders and collaborators who would be willing to sign on to develop and execute a collaborative multidisciplinary study to look at the health impacts. And some of the criteria that we insisted on were that it had to be unbiased, scientifically rigorous, and collaborative. So I'm a scientist by training, so I'm very data-driven, and I need data to make sound conclusions, and that's really where we're coming from. There are obvious advantages to a coordinated approach, and some of them are listed here. It's a complex problem, and getting data from multiple sources is really important for understanding the problems in context. Coordination obviously allows for more efficient use of resources, and one of the things that others who are interested in studying this, including us, are finding is there aren't people standing in line writing us $1 million checks every day to do this. So fundraising is something that we've spent a lot of time on, and we've had some success to date. And then I think in terms of long-term impact, a coordinated study would have more visibility and more stakeholders. I think ultimately is more likely to produce the changes that need to be made once we know what they are. And again, it's a challenging problem, and again, I don't need to spend a lot of time on this. Some of the exposures are difficult to assess. We don't know some of the real health effects of many of these compounds, as was mentioned earlier. There's difference across wells and sites, and again, it is a life cycle. It's not just the hydrofracturing itself. There's lots of things that go on before and after that are of potential concern. And I'm sure you all know that there are many competing interests in here, industry, government, and I can put scientists on that because I think some scientists that I'm talking to are, I think in some ways not helping the cause a lot in terms of insisting on things being done a certain way and being, I think, a little bit stubborn in this. There are many preconceived biases, and then there are, of course, obvious political implications. I'm not going to say any more about that. So, progress to date. So, we spent a lot of time last fall talking to, phoning, meeting with potential collaborators, and in January we hosted a meeting of those potential collaborators in Washington, D.C., and we got very enthusiastic support. There's a broad range of participants. From that, we put together an executive planning group from multiple institutions, including academic investigators, other healthcare systems, government research agencies. We have collaborative agreements. We now have some initial funding to get started, and we're launching a pilot project. So, what are we actually interested in? So this is a high level of the domains of the study that we've outlined. So they fall into three main buckets. Of course, there's interest in the environmental exposure, so the drilling, waste disposal, potential leaks, part of the life cycle can have impact on water quality and air quality. Those are the two that we're focusing on right now. There's obvious impact on the communities. There's, as mentioned, there's an increase of wealth that's going to some of the people who live in these communities. There may be strains on infrastructure. Some of the social structures could be disrupted with some of the downstream effects of those. And of course, our primary interest is in how these affect downstream the health and quality of life of the people. And this is not a complete list of the things that we're interested in looking at, but I think a lot of the usual suspects are indicated up there. And I'll give you another list in a minute. So our initial aims are listed here and on the next slide. First, there is existing data that we can use, and one of the things we want to do is consolidate that data and use existing data when it's available and it's reliable. There will be gaps, so we need to figure out how to fill in those data gaps. But really, I think that the central part here is our goal is to create a consolidated database that would be shareable and usable to anybody who's interested in doing quality research in this area. So we don't view this as a proprietary resource for Geisinger only. We're going to collect biological samples and bank those for future use. And we're going to initiate some pilot studies. I'll give you a list of what those are now. And then we're also launching efforts to look at some of the social and policy questions. And of course, what's going on in New York State is on everyone's mind right now in terms of what are they going to do? Are they going to do the right thing? So, I'll just list a few of the formal collaborations. So we've enlisted two other regional healthcare systems in the north-central and northeastern part of the state. Guthrie Health System is one of them. Their headquarters is in Sayre, Pennsylvania, which is strategically placed right on the Pennsylvania-New York border. Half their patients live in New York, where there's been essentially no hydrofracking. Half their patients live in Pennsylvania, in one of the most highly affected regions. So in some ways, it's an ideal natural experiment. And so we can look at people based on where they live, see if there might be potential health impacts. Another important one is Secretary Avila, the Secretary of the Pennsylvania Department of Health, has agreed to that the department will collaborate with us in this study. One of the things it does is gives us access to data the Department of Health has. One of the deputy secretaries in the department is going to be a member of our executive planning team, so we're really excited about that. We have a number of academic research partners with expertise in environmental science, and epidemiology, and clinical medicine. So it's a long list, so I'm not going to give specific names. So the basic approach is listed here. So we're going to consolidate data from multiple sources, so our health systems and other sources, put those into this shareable central data warehouse, and then use that initially to launch a series of what we're calling surveillance studies, we call them pilot studies. Basically, we know where our patients live. We've geocoded them using GIS technology, so we know to a fairly high degree of precision where they live. We're now beginning to overlay that on data we have on drilling activities. We've geocoded that, as I've shown you, and there's other data as well. And also where it's available, data on air quality. We're using some air quality modeling experts to help us do that. also water quality, and we're working with some other folks who are experts in that to do that. So the idea is that by overlaying all those data sets, we'll be able to get some initial signals as to whether and where and what the nature of these potential health impacts might be. So we're not just probing in the dark. And then the results of those will then lead to and guide more focused and perhaps more scientifically rigorous hypothesis-driven studies. So for example, these will tell us the nature of the chemical exposure that might have caused that disease. But it might give us a signal that is something that is worth investigating in more detail, and that's sort of, it's a hypothesis generator that will lead to these more detailed studies. So I refer to this as a phased and tiered approach. So one of the last things I want to say is that to create this consolidated data warehouse that also incorporates health data, including health data from these other health systems, we at Geisinger have a lot of experience. Our health IT group has been the drivers of regional health information exchange, where they've developed processes and infrastructure and expertise to do that, to get health data from patients, to standardize that and put it into a central shareable database. So we have lots of in-house and in-place resources to do that and to make it very feasible. This is the list of the pilot studies that we've launched. Asthma is one, so impact on air quality is something that has certainly been discussed. One of the nice things about asthma is that people who have asthma that are exposed to certain air pollutants will have an immediate and medically very definable clinical outcome. That's data that's fairly easy for us to get out of our electronic health records. There's a lot of interest in perinatal outcomes, and I know it was discussed earlier in terms of the effect on animal health. Again, there are 4,000 births per year in our health system in this region, so we have a large database in which we can draw and look at those kinds of things, and that's captured in our health record. There's anecdotal data that there's increase in motor vehicle trauma in these regions. You saw some pictures of some of the big trucks, and if you've driven up in that area, you see that these are mostly rural areas, small two-lane windy roads, hilly. So again, we'd like to know, A, if that's really true, and if so, what's behind the numbers. Cardiovascular disease is another one, and also I mentioned the community impact, which is something that we're going to be looking at through studies. So this is my last slide. I guess the real question is, why are we doing this? I think ultimately we'd like to get solid scientific data on which we can base some policy. We can propose regional mitigation strategies if they're warranted. We're very big into the health prevention world, so if there's things that can be done there. And also I think many physicians, if there's some in the room, there's really not a lot of information on which an individual physician can go on if they have a patient that comes to them who thinks they've been harmed in this way. So one of the things we'd like to do is develop some clinical decision support tools to help those physicians. And that's my last slide, and I will.
That's terrific, and that's a great lead-in for Raina Rippel, who's actually been working with individual patients in Washington County, Pennsylvania. So I'm going to... Actually, I'm going to go sit down.
So I wanted to put this slide up to begin with to point out, and that feeds in, again, that was a great segue into exactly what we have started doing, which is this event which we did on July 20th, 2012, was our pilot of a training project or a training program to get information out there actually to healthcare providers. And I just start with this slide to just kind of give you an indication of what we're doing. Then I'm going to backtrack a little bit and tell you what our project's about. The first thing I need to say, first and foremost, is we're so excited to see some of the research that's happening. We think that there's some great strides that are happening there, but I want to clarify, first of all, that our project is not a research project. I'm really excited to be here today and to be working again with Physicians for Social Responsibility. That is where my expertise came from. I worked for many years as the executive director for PSR Maine. And in that project, in that process, I put on some different environmental health conferences in the state of Maine. And that's led me to where I am today, which is working with what honestly is the most amazing team of public health professionals, researchers, and those of us who are literally on the ground. I have to emphasize that I'm here to testify from southwestern Pennsylvania. You know, there's some great people in the audience who I want to give a shout out to, but we're on the ground, we're in the trenches, we're on the front lines of the energy debate in America. And so, again, we're not a research project. We're not there to do research. We're there to craft a public health response to what we see happening on a daily basis. And so what you'll see as I go through these slides is we support the research. We're working with some great partners in terms of trying to do more of that. But again, I have to continuously emphasize this is not a research project. That's not our aim. That's not our goal. So what our goal is to, again, provide very tangible, on-the-ground responses to the people, primarily within southwestern Pennsylvania, but beyond that at some point. Educate healthcare providers, educate citizens, give them whatever tools we can for them to make a difference on a daily basis in their lives, to start to reduce their exposures, to figure out what may or may not be happening to them. And this is happening, of course, in the context of so much uncertainty. And that's why, of course, we support research that's going on, but we feel it is imperative for us to act in the face of that uncertainty, to take whatever knowledge we can find, whatever scientific evidence there is out there, whatever empirical evidence there is, translate that and provide tools for people on a daily basis. So that's our mission. This, again, was one of our first big projects that we pulled off, and this happened on July 20th, 2012 of this year. And you'll see here, I meant to bring a copy of this, a paper copy of this, but this is all on our website, and I really encourage people to go through this because there's some tremendous materials up there. And every single one of these pieces, there's a lot of materials which are just not affiliated with our project, which we brought in. But the things which we have developed, I think, are some of the strongest pieces of information out there that physicians, public health care providers, nurses, healthcare professionals, and everyday citizens can start to use to dive into this issue and start to understand it much better. I'll point a couple things out. Again, we've got these toolkit materials. We've got some very tangible resources for physicians and healthcare providers to start using today. The well water testing report, I'm going to come back to that and talk about that a little bit more. That's a really big thing that we had. Right now we're in the process of doing intakes. So we're essentially doing an environmental health history for patients coming to us who we know are seeing concerns that they feel are very closely associated with gas drilling activities. So it's not neutral, it's not research oriented, because it is, again, there's no control group, and honestly, I have to say, I think it's going to be hard to find a control group in southwestern Pennsylvania. Western Pennsylvania, there's definitely some more counties that are not impacted, but I myself live downwind of one of the largest gas processing facilities in the county, and we're all downwind, and we're all downstream in southwestern Pennsylvania. So, again, we have these patient handouts, we have a really great professional reference list, and I strongly encourage people to go on our website and check some of these out. There's some amazing tools. Just so you know, these are the presenters that we had as part of this July 20th event. So we're working with Pune, Dr. Saberi out of Philadelphia. She's been fantastic and really helping us out a lot. Peter Rabinowitz came to us from Yale. And Denise Dijon is our nurse practitioner, and that really is the crux, the core of our project, is to have that nurse practitioner there on a daily basis to respond to patients' complaints and try and work this out with them. And at the very least, provide an understanding ear to listen to their concerns. And that, I think, is one of the primary things we've found as people have been coming to us, is that a lot of times they feel like they're not believed. And I think one of my big core messages here today is so much of what you're going to hear in Pennsylvania in particular, and in other parts of the country, in Texas and Colorado, appears to be unbelievable. And my message for you is believe it. Believe it. I'm thrilled to be here to testify on behalf of the residents of southwestern Pennsylvania and myself, because it's happening. And I hear presentations that happen. I heard a presentation recently where somebody said, well, the state of Pennsylvania has the strongest regulations on the books. And that's fantastic. And I mean, this was somebody who was well-credentialed, a very high-profile person within the academic community, and that's fine, you can say that. But you have no concept of what's happening on the ground. That's not what's happening. It's absolutely night and day from what's happening and what we see happening. So again, you know, I can testify on behalf of the residents. It's unbelievable. It's crazy. I mean, these people are living in sometimes a virtual nightmare. And you know, I try to play both roles. I try to play, and that's one of the things that I am uniquely situated to do, is to try and link into the academic communities in our area, to try and link into the research, and we've got, again, this fantastic team of people. Leslie Wally, our physician consultant, she's actually here today. I'll point her out at some point. Actually, Leslie, you want to just stand up and wave hello? Leslie's here as well. So we're doing that. We're trying to serve as that interface between, say, the research, the academic community, but yet bring those tools to people and make them understand that, yes, their concerns are real, that this is not just about research, that this is not just about some idea out there of energy and jobs and all these fantastic things, but these people are suffering right now from serious quality of life issues, if nothing else, serious quality of life issues. And I can talk about that more. But this is what makes me realize that we're not on the fringe. We're not doing anything that's really out of the question or out of the ordinary. These are actually the Marcellus Shale Advisory Commission's health recommendations for Department of Health activity that came out of the state of Pennsylvania. And I saw this put up on a slide recently, and I said, wow, we are doing all of that. In this small office in southwestern Pennsylvania, in Washington County, almost every single one of these things we are currently attempting to do. And the state of Pennsylvania did not fund this. So, again, we're doing it at a very small scale, and we're doing it, you know, without the benefit of having it be well-researched necessarily. I mean, we're applying whatever research we could possibly find. We've got some fantastic researchers working on this project. If you have any questions about the credentials of the people I'm working with, please check out our website. The best minds in the country, I think, are some of the people I'm working with. You know, we've had just incredible support coming to us to do this at the best scale that we can. Second slide is just, again, taking you through the rest of it. We're doing this. I mean, this pretty much defines my project to some extent. I mean, so I can talk at length, and I'll talk more on the panel about how we're doing these different things, but I just wanted to point out that, again, this is happening. We're doing this. It's on the ground. People who know me know I'm a very action-oriented person, and so we are taking action. I wanted to emphasize a couple things in this slide. First of all, although the numbers are small, we are seeing many of the same symptoms that are coming out, and these are similar in some ways to places outside of this area, in Colorado, in Texas. There's a tremendous amount of similarity out there. So we have to understand that even if the toxic exposures aren't very well understood, the symptoms are appearing and there's a lot of consistency. And so this is just a short list of what we're seeing. And this translates, again, I think, to other parts of the country where these gas-related activities are happening. So we need to start understanding that, again, we need to have an appropriate response to this, and that's probably my primary ask today. Just for more information, again, please, I encourage you, go to our website, tease out some of these materials. Please check them out and use them. That's what we're here for. We're here as a resource, and we're here to link people in with whatever research activities we can partner with that's going to be, again, very tangible, very action-oriented. And I just want to wrap up my remarks briefly with a few notes. Again, obviously I made my point. You have to believe that these things are happening. I'm a mom, I'm a new mom, and it's heartbreaking sometimes. So I'm here to testify, again, on behalf of residents. And what you see happening to people whose kids are impacted, they don't know what's going on. They do not know what's going on. But they have tremendous courage. And these are not transient people. These are people who lived on this land for generations. And they had every intention to live on this land for generations to come. Their quality of life, in many cases, has been destroyed. So let's start from that. Let's understand that there are tangible impacts, there's empirical evidence, and if you just took everything else aside, and you looked at the stress, and you looked at diesel and stress, you would know that this is happening. You would know that there are problems. So we have to, unfortunately, chase after the numbers. We have to get the data. We have to do this in order to encourage policy. But do not leave here today with any question in your mind that the debate about whether there are health impacts needs to end. There are health impacts. There are quality of life impacts. They are real. We are seeing them. And we need to figure out how to address those. And let me just give a couple points, calls to action. Again, and this is for the Philadelphia area, you can be our support team. Because you're not on the front lines of this. You don't want to be on the front lines of this. Trust me on that one. But we need medical expertise. We need research. We need resources. And again, the people who are here from southwestern Pennsylvania are doing heroic efforts on a daily basis to provide water to people who no longer have water. Sorry. It's unbelievable, but you have to believe it's happening. That in the United States of America today, an industry has come and taken away people's water with no punitive enforcement that is happening. That is the situation on the ground in southwestern Pennsylvania today. So medical professionals, people outside of the area, the fundraising community has been fantastic. We've gotten a tremendous amount of support from them. But there's a mandate for this to expand, for these resources to go as far and wide as they possibly can, because we have to help these people here and now today. We can't wait for 5 years. We can't wait even for a year. We have to help them today. And so that's the message I leave you with. Figure out whatever you can to work with your patient populations, to educate yourself. Again, look at our materials online. Spread the word. It's happening. Thank you.